If you're on Plan N right now, and you think you can just switch to Plan G later if you ever need it, stop for a second. Linda thought the same thing. She saved $20 a month, and 10 years later she needed better coverage. So she tried to switch to Plan G. She was denied. But here's the strange part. Linda's state even had a special rule that let people change Medigap plans. And she was still denied. Why? This isn't just a story about California. The plan you choose today and the plan you'll actually be able to switch to years from now are not the same question. Daniel and Linda started from the same place. They turned 65 the same month, in similar health. Daniel chose Plan G. Linda chose Plan N. At first, the difference was $20 a month. 10 years later, the difference wasn't $20. It was choice. So why did Daniel pay $20 more a month? To see the answer, you first have to look at one number in original Medicare. After you meet the Part B deductible, Medicare pays 80% of the approved amount for many Part B services, and you pay the other 20%. The problem isn't the 20%, it's that the 20% has no ceiling. Original Medicare has no standard annual out-of-pocket maximum. If you had $200,000 in Medicare-approved Part B charges subject to that 20% co-insurance, your share would be $40,000. $40,000. That's why Medigap exists. Whether it's Plan G or Plan N, it covers most of that gap. But right here, a question comes up. If both of them cover it, why did Daniel pay $20 more for Plan G? In 2026, the Part B deductible is $283. And here's the key part. Both plans leave you with that deductible. So the real difference between them wasn't the $283. Plan N still leaves you with some doctor's office and emergency room copays, and more importantly, Part B excess charges. Some doctors who don't accept Medicare assignment can, in certain cases, bill up to 15% above the Medicare-approved amount. Plan G covers those excess charges. Plan N does not. Daniel didn't pay $20 more because he predicted he'd get sick. He paid it so that if those differences mattered later, he wouldn't have to gamble on switching plans then. Linda thought the exact opposite. I'll just switch when I need to. And 10 years later, that idea was put to the test. Here was Linda's thinking. I'm healthy. I'm not going to run up big medical bills. And the deciding factor for Linda was this. If something happens later, I can just switch using that rule. That switching rule had a name, the birthday rule. Linda lived in California, and California actually had one. It gave her a protected window beginning on her birthday and lasting at least 60 days when she could move to a Medigap plan with equal or lesser benefits without being denied because of her health. At first, Linda came out $20 ahead each month. But the year she turned 75, things changed. She was diagnosed with a chronic condition and started seeing a specialist who didn't accept Medicare assignment. That doctor could, in certain cases, bill up to 15% above the Medicare-approved amount. And those excess charges landed on Linda because Plan N doesn't cover them. So Linda decided to use the birthday rule, Plan N to Plan G. She filed the application. Along with the application, Linda received a health questionnaire. Something felt wrong. Wasn't the birthday rule supposed to skip the health questions? Linda called the insurance company. There's a birthday rule. Why am I getting a questionnaire? The representative explained, California's birthday rule exists, but that protection only applies when you're moving to equal or lesser benefits. Going from Plan G down to Plan N is protected. Going from Plan N up to Plan G is not. Linda didn't understand. So I can't even apply? The representative said, you can apply. You'll just need to pass medical underwriting. Linda applied anyway. A few weeks later, the answer came back. Denied. In Linda's case, the insurance company denied her application after reviewing her medical history. And that's when it hit her. The birthday rule protected a move to equal or lesser benefits, but it did not protect an upgrade to richer benefits. The door going down reopened every birthday, but the door going up was never guaranteed. For Linda, That upward door depended on whether she could pass medical underwriting. During her healthier years, she still had a chance to walk through it, but she thought she'd never need to. And the moment she actually needed it, underwriting closed the door. But that leaves a harder question. Was Linda wrong to choose Plan N in the first place? So why does this happen? Because Medigap isn't built to let you switch to whatever plan you want after you already need it. Once you're 65 or older, and your Part B coverage starts, you get a one-time 6-month Medigap open enrollment period. After that window passes, if you don't have a special protection, medical underwriting can show up at the door again. California's birthday rule is one of those state protections that opens an extra door. But here's what Linda missed. That door wasn't a ladder from Plan N up to Plan G. In California, for at least 60 days starting on your birthday, you're protected when moving to a Medigap plan with equal or lesser benefits. Moving from Plan N up to Plan G was outside that protection, and this part matters even more. The rules are different from state to state. Some states give you additional switching rights. Others have different conditions and different windows. So the idea that you'll just switch to Plan G later when you need it is something you need to check first, because there's no guarantee that door will still be open later. Back to Daniel. At the original $20 monthly difference, the simple 10-year total is $2,400. Linda saved that money. That's true. But there was another price that never showed up on a bill. Choice. The $20 Linda saved was visible every month. What Daniel bought was invisible. If those extra benefits mattered later, Daniel wouldn't have to ask an insurance company to open that door for him. That was the real meaning of what he paid extra for. For 10 years, Linda saved on premiums. Daniel bought something else. He made that future decision while it was still his to make. The easy conclusion is this: Daniel was right. Linda was wrong. But that's not really the point. Linda's strategy wasn't automatically a bad one. Starting with lower coverage while you're healthy to save money can make sense for some people. The problem wasn't the strategy. The problem was that Linda didn't know the birthday rule wouldn't protect an upgrade. If she had known that, she could have looked at Plan G while she was still healthy. But Linda waited. And after the diagnosis, medical underwriting was standing at the door. What Linda lost wasn't the savings. It was not knowing when that door could close. If you're on Plan N or another Medigap plan and you think you may want to move to Plan G later, check 3 things. First, if you tried to move to Plan G today, would you have to pass medical underwriting? Don't just ask whether you can switch plans. Ask whether you can get to Plan G without medical underwriting. Second, does your state give you broader Medigap switching rights beyond the federal baseline? Some states have a birthday rule, like California, but the rules vary by state. Third, if that protection exists, exactly which plan-to-plan move does it protect? Don't just confirm that there's a window. Linda knew there was a window, but what she didn't know was the direction. Plan N up to Plan G. That's the direction you need to confirm is protected. More important than whether the door is open is whether it opens in the direction you're trying to go. Both made reasonable choices. The difference wasn't the money. Daniel's choice didn't depend on moving up later. Linda's did, but Linda never checked whether that door opened in her direction. If you're on a lower benefit plan right now, and you believe you can move up later, there's one thing to confirm. Not whether you can switch when the time comes, but whether you can still switch after your health has changed. And I'm curious, are you on Plan G or Plan N? Tell me in the comments why you chose it.